Hi, my name is Madison Evers, and I'm going to be demonstrating an IV insertion today. So first we're going to verify the physician's orders and gather our supplies, and then we're going to identify the patient with two identifiers and compare it with their ID band. So I'm going to introduce myself and explain what I'm going to do to the patient and confirm any history of allergies, check their chart, ask them as well, see if they've any complications they've had with previous IVs. And then I'm going to assess my site and see if there's any contraindications. And then I'm going to ask them about any previous IVs that they have had. And then I'm going to do some hand hygiene and apply my gloves, my clean gloves. Okay, so then I'm going to apply my tourniquet to check and see where I'm going to use my site. So I see a nice medial vein right here, so that'll be a good site to use. So I'm going to pop the tourniquet and clean that site that I identified. I'm going to clean back and forth for 30 seconds and then allow that to dry. So while that's drying, I can put together my supplies. So I already primed my J-loop, and then I can just get my needle ready. Okay, so after the site has had time to dry, I'm going to reapply my tourniquet. And then I'm going to check the pulse. And then I'm ready for venipuncture. So I'm going to anchor the vein, pulling down and away with my non-dominant hand. I have my bevel up, and I'm going to do 10 to 30 degrees. And I will insert. And then I will slowly advance my catheter in. And after that's inserted, I will pop the tourniquet and apply my safety. I'm going to occlude the vein and then apply my extension tubing. So after that's applied, I can flush with 2 to 3 mils of saline. And then I'm going to secure my catheter hub. Along with the extension tubing as well. And then I'm ready for my tegaderm. Making sure that there's no blood along the site and that if I have to clean any of that up. Okay, and then I have my sticker with the initials, the date, the time, and the gauge of the needle. And then now I'm going to remove my gloves and document everything that I did, and the date and the time, the IV solution, the gauge of the needle, all of that, and the patient's response, and that there was no IV complications observed.